Menopause is an important topic because women spend at least a third of their lives in the menopausal period. The average age of menopause is 51 years, and the perimenopause refers to the time period 2 to 3 years leading up to the last menstrual period, but also 1 to 2 years following that. So there's at least a 4 to 5 year period that we call the perimenopause. And it's important that we consider the perimenopause as a state where women can still fall pregnant. So if we manage symptoms during this phase, women can still fall pregnant, and that must be a consideration. If menopause occurs before the age of 40, or if the ovarian function declines before the age of 40, we call that premature ovarian insufficiency. And it's important to distinguish between these two conditions because the hormonal therapy is quite different with regards to dose, where we use the least possible hormonal therapy after the menopause. That still gives you the benefits, but without the risks associated with it. In women with premature ovarian insufficiency, we need a significant amount of estrogen because they do not have ovaries, and we want to preserve their cardiovascular risk, bone health, and so forth. So why is menopause important? First of all, patients suffer due to menopause in various ways, so the symptoms of menopause, but also, as I've alluded to, the cardiovascular and bone risk. So we know that the risk of cardiovascular disease increases exponentially after menopause, and we also know that bone loss increases to around 2.5% per year after menopause. And as a preventative measure, we want to decrease these risks over and above treating the symptoms that we will discuss in a subsequent video.